I am Dr. Aleena Khatib, a dental surgeon. Thank you for having me here. And today I'll be discussing how tech and innovation can disrupt the healthcare sector under the topics healthcare sector, healthcare pre COVID, impact of COVID, and disruption in healthcare. Well, what is healthcare sector? The healthcare sector contains a diverse array of industries with activities ranging from research to manufacturing to healthcare facilities and management. But as a doctor, I would like to share more about healthcare facilities that include hospitals, clinics, laboratories, psychiatric facilities, and nursing homes. Well, before COVID, the situations were a little different. Healthcare sector was and still is least digitalized as compared to others. Like every other individual, even some doctors are very reluctant to bring changes and making some changes in the society. Like COVID, but COVID helped in adapting the changes as they were left with no choice, and there was lack of infrastructure to accommodate the changes back then. Well, now the situations are different. Though COVID was disastrous, no doubt, and impacted all of us in some or the other way, but here I'll be more focusing on the positives that it has brought into our lives. Well, it has made us realize that at some point, technology can serve as a lifeline for people. It was a watershed moment for digital healthcare, where data driven handling of COVID cases and decision making was possible. With the help of analytics and data modeling, with the help of mobile applications to monitor quarantine individuals. Well, digitalization by maintaining all records, data like important information regarding patient's condition, how it needs to approach for providing better treatment. Applications and softwares were running all over the world by doctors to monitor quarantined individuals. Patients were able to take online consultations. Doctors, scientists, research teams working all over the world were able to keep in touch, maintaining lockdown scenario. Well, it is not the strongest of the species that survive, not the most intelligent, but the one most responsive to change. So, this COVID brought so many changes and made us realize that change is the only constant. Now, I'll be discussing about what I foresee in healthcare sector, which is a very important topic here: disruption in healthcare, advancing personalized care. So there is the increase in available data, testing capabilities, and cutting edge technologies mean that we may finally be entering the long promised golden age of personalized healthcare. By better understanding an individual's genetic profile, more effective therapies can be used. For example, in future, before treating any woman for breast cancer, a genetic test could determine what genetic variations are present. The internal complications could be diagnosed. This is all because of the technology and the tech that is coming into our lives. And yes, moving to the next point is digital health or telehealth, connecting patients directly to doctors in far health facilities. Basically, that means patients sitting in rural areas can directly connect with the patients in urban areas. It will become much easier using mobile technology to centralize expertise, which help to avoid unnecessary referrals and reduce cost for the patients. Well, the next slide moving on is streamlining healthcare services and driving operational effectiveness. Automation. Automation will help in day to day activities. Now, what automation basically is, for example, remote surgical robots. A surgeon from UK actually was able to successfully remove the liver of an animal from 30 miles away. Well, other easy example can be like if a patient is in a situation of emergency and needs an ambulance, it is going to take plenty of time for the ambulance to reach. The treatment needs to start and everything, all this scenario. This is an underlying gap where automation can be of use. Now, this is another important empowering patients. As technology becomes standardized, patients will gain more and more control over their health information. That is how it works in a way that patients already gather some amount of information personally before reaching the doctor. That is what is happening nowadays in our society. How this helps is they are already aware about the situation and have a rough idea about it, which helps in better understanding and unnecessary referrals. Like such thoughts come into patients' mind, like after consulting one doctor, they have doubt in their mind and they want to refer another and another and another. It takes plenty of time. and this goes on. Now, healthcare on demand. This healthcare should be a hassle-free on demand service. This will be a game changer in the healthcare domain. This is a very important point because basically the healthcare service should be on our fingertips. Any emergency, any instant care, like there has to be less period of time and less wastage of time. Lastly, goals of innovations. Well, goals of innovations, it basically revolves around consumers, that are patients. Patients' convenience, comfort, compliance, and their satisfaction is the end term motto. Well, it is the most important part basically. I would like to end with one of my favorite quotes: innovation is the ability to see change as an opportunity, not a threat. Thank you.